Connecting before and after a task, or planning forward and reflecting back, is a good way for teams to effectively communicate and work together. Planning forward before a patient care event or assignment is an opportunity to create a shared mental model. There are 4 parts to a good plan forward conversation. Everyone gets to know the game plan, psychological safety is ensured, the norms of conduct are discussed, and the expectation of excellence is set.
Hi everyone, I've asked to meet quickly so we can touch base on Sharon Brown's lumbar puncture, just so we know what to expect. This test will tell us whether the chemo has been effective. So Kathy, let's follow the usual procedure. But John, Sharon's O2 sats were rather low due to her lung infection. I'm thinking that the position that we'll need her in for the test will further compromise her breathing. Her respiratory condition has been unstable to say the least.
Okay. I'll be sure to monitor oxygen levels and be prepared to respond as necessary.
Okay, let's go in.
There's one thing I'd like to add. Sharon's daughter is here and she would like to stay for the test.
Okay, anything else?
No.
All right, let's go. Hi Sharon, and hi Mary. I'm Dr. Allen. Sharon, how are you doing today?
I'm okay, but I'm finding it hard to breathe.
Absolutely, we appreciate that, and we'll try to get that addressed as soon as possible. Can we explain the procedure to you today? John, can you go ahead?
Yes. Hi Sharon, I'm John. I'm a respiratory therapist and I'll be monitoring your breathing during the test.
Hi, John.
Hi Sharon. As you know, I'm Kathy. I'm a nurse and I'm here to help Dr. Allen do the procedure. Dr. Allen, I'm concerned that during Sharon's last procedure, her daughter was asked to leave the room. They've both indicated to me that they would prefer it if Mary could stay. Are you okay with that?
Sharon, is that okay with you?
I'd like Mary to stay.
Okay, that's fine with me.
Okay, Mary, can you help me get your mom into position, please?
Reflecting back, following a task or patient care event allows the team to learn from what took place. 3 questions can be used to reflect back. What went well? What did we learn? And what could we do differently next time?
Okay, good. All right, let's quickly discuss what went well. Sharon, let's start with you.
It wasn't so bad, thanks for asking. I think it went better this time because I knew what to expect and because Mary was here with me.
I think things went very well. I'm really glad we talked beforehand and we had a plan for the procedure. And Mary, I really appreciated all your help.
I liked being able to help my mom. Last time I was out in the hall worrying.
From a respiratory standpoint, things went very well.
Okay, good. Well, what did we learn and what can we do differently for next time? Sharon, we'll start with you.
It wasn't so bad. I'm just so relieved it's all over and I can't wait to hear the good results.
Absolutely, and waiting is hard, and we'll try to get those results to you as soon as we can. Kathy?
Next time I'll make sure the cart is stocked with your gloves, and I'm going to focus on repeating instructions back more concisely.
Absolutely, and that is something that we should all be working on. John?
Probably the one thing I would do is move the bed out a bit more from the wall. That way, if there were any respiratory difficulties, I'd be better situated to provide care.
Okay. Well, great job, everyone. And Sharon, I think it's time for you to get some rest.
Thank you.
Effective teams use effective communication. Plan forward and reflect back is a communication tool you can use to connect with your team before and after a task to create a shared mental model and to learn from what took place.